Alright, just in case you were ever wondering what's the proper way of doing a refusal of medical attention, in this video I'm going to explain to you how to do it and CYA at the same time. If you don't know what CYA means, it means cover your A. Alright, so when you come upon a patient that doesn't want to go to the hospital even though they should go, remember that if they're alert and oriented ×3, you cannot force these people to go. Now, if for an instance they're not A&O ×3, then you could get the police department involved, you could get telemetry involved, or you could get a condition supervisor involved in assisting in getting this person to the hospital, even though they don't want to go. And also remember, before you get these people involved, try to also get involved a family member that's cooperative and could maybe get through to the patient, and you could avoid reaching out to all the people I mentioned before if maybe the patient's daughter will talk them into it, for example. Now, if you're in a situation where the person's alert and oriented ×3 and they still don't want to go to the hospital despite the fact that you suggest that they should, remember that if they answer the person, place, and time questions, they're considered to be competent enough to make their own decisions, so you have to respect their autonomy. That being said, also, if they are cooperative and allow you to, you should exhaust all your diagnostic capabilities before you get the signature for the RMA. So as a paramedic, the diagnostic capabilities are your vital signs, your EKG, your blood glucose level, and maybe even a 12-lead EKG. These diagnostic capabilities, and also the pulse ox, similar. So the benefit of exhausting your diagnostic capabilities is that, one, you know morally that you made an effort to try to find a reason to talk this person into it. So for example, if they get a hypotension, maybe you could use that hypotension or hypertension to talk them into going to the hospital. And also, it looks good on paper. Once you submit that paperwork and you submit that you did a EKG, you did take the vitals, at least two sets of vitals, that you take the BGL even though they were alert and oriented ×3, it makes you look efficient as a paramedic, and that's what we all here are striving to be. So in a nutshell, if you have a person that should go to the hospital, and you want them to go to the hospital, try to involve family members that cooperate to try to talk them into it. If not, then involve telemetry, involve the condition boss, and maybe even the police department, so they can force this person to go. And also exhaust your diagnostic capabilities if you are going to accept the RMA. So get the EKG, get the BGL, get the vitals, get the pulse ox, and after that, if the person's A&O ×3 and they still don't want to go, accept the RMA, get a signature, and get a credible witness signature. You could use your partner as a witness, but if you have the person who called 911 on scene, then that's great. If you have another medical professional that you can use as a witness, that's even better. All right, guys, I hope this helped. Peace.